There's a question that very few dare to ask in a doctor's office. Is it possible that this routine checkup could do me more harm than good? Every year, millions of adults over 70 attend their medical appointments, confident that each test is another step toward a long and healthy life. But what if I told you that behind the curtain of preventive medicine, an uncomfortable reality is hiding? New research suggests that an alarming number of these routine checkups in older adults are not only unnecessary, but also trigger a cascade of events: misdiagnoses, paralyzing anxiety, and invasive treatments with life-altering complications. The most disturbing part is that most people don't know they're at risk. In fact, one of these screenings, the one at the top of our list, exposes patients to a known cancer risk factor in an ironic attempt to detect the disease. You won't see this information in clinic brochures, but the scientific evidence is clear, and today we're bringing it to light. In this video, we unveil the 5 health checkups that, according to experts like Dr. Alex Thornton, you should reconsider and discuss thoroughly with your doctor if you're over 70. And believe me, the truth behind test number 2 will surprise you. Before we dive in, we'd love to know where in the world you're watching from. Has a medical test ever caused you more worry than relief? Do you think modern medicine is sometimes overzealous with older adults? Leave your comment below. Your experience is valuable to our entire community. And if you find this topic important, please hit like and subscribe so you don't miss our future investigations. Now, let's begin with the checkup that seems harmless but could be silently sabotaging your well-being. Checkup number 5. The bone density scan. It seems like the simplest test in the world. A quick, painless scan, and in minutes you have a report on your bone health. But here's the part that's often left out. After 70, this scan can become a fear generator. The test, known as a DEXA scan, measures your bone mineral density to detect osteoporosis. The problem is that in older adults, it's almost guaranteed to show some bone loss. Why? Because, just like wrinkles or gray hair, our bones naturally become less dense over time. It's a normal part of aging. However, with that result in hand, many patients are pushed to take powerful drugs like bisphosphonates. And this is where the risk-benefit scale tips dangerously. These drugs, designed to strengthen bones, carry a list of severe side effects, including a devastating condition where the jawbone literally begins to die. Experts like Dr. Alex Thornton warn that for older adults without a history of falls or fractures, treating mild bone loss with these drugs has a minimal, if any, impact on preventing future fractures. Instead, patients are left exposed to the risks. Consider the case of Arthur, a 78-year-old retired history professor. Active and with no prior falls, his DEXA scan showed osteopenia, a mild bone loss. He was prescribed a bisphosphonate. Within a few months, Arthur developed such severe esophageal pain he could barely eat. After seeking a second opinion, he stopped the medication and adopted a plan focused on strength exercises with resistance bands, vitamin D supplements, and a diet rich in natural calcium from sources like yogurt and leafy greens. A year later, his balance and strength had noticeably improved, with no fractures and none of the painful side effects. The lesson is clear. A number on a report shouldn't push you into a treatment you may not need. But there's another type of scan that can lead to something far more feared: an intervention in the brain. Let's talk about that now. Checkup number 4. The brain MRI for mild forgetfulness. When an older person starts forgetting names or misplacing keys, the fear of Alzheimer's or dementia is immediate and overwhelming. The common medical response is often a brain MRI to see what's going on. But here is the uncomfortable truth. In most cases, these images do not provide clear answers. What they almost always find in people over 70 are perfectly normal age-related changes, small white matter lesions, or a slight reduction in brain volume. The problem is, once these abnormalities appear on paper, panic sets in. And that panic leads to more tests, spinal taps, biopsies, and even surgeries, which not only fail to improve memory, but can actually make things worse. The research in this field is eye-opening. An infinitesimal percentage of MRIs performed for mild cognitive complaints find a treatable cause. This means the vast majority of people go through the anguish of hearing, "We've found something in your brain," when that something has no clinical relevance at all. Imagine Clara, a 75-year-old former accountant, worried about her memory. The MRI showed the typical age-related changes. Convinced it was the beginning of the end, Clara became socially isolated, and her anxiety soared. However, a formal cognitive assessment, done at Dr. Thornton's suggestion, showed her score was completely normal for her age. They focused on what actually works: improving sleep quality, hydration, and doing brain-training games. Within a few months, Clara regained her confidence, and her memory stabilized. Unless there are alarming neurological symptoms like seizures or drastic personality changes, a cognitive assessment is a much more sensible and safer first step. It avoids the trauma of a frightening finding that, in reality, means nothing. Now, get ready, because the next test is one of the most common, and it's at number 3 for a very serious reason. Checkup number 3, the cardiac stress test. This is the standard procedure when an older adult mentions feeling a little more fatigued than usual. They put you on a treadmill, monitor your heart, and look for signs of blocked arteries. Sounds logical, right? But the reality, especially after 70 in people without clear symptoms of heart disease, is that this test generates a huge number of false alarms. And a false alarm in cardiology can lead directly to invasive and risky procedures that were never needed. Studies published in prestigious cardiology journals have shown that the false positive rate for this test is surprisingly high in older adults. This starts a dangerous chain reaction. An ambiguous result leads to an angiogram, where a catheter is threaded up to the heart. There, doctors might find an artery with mild narrowing, a common part of aging, and decide to place a bi-stent. Dr. Alex Thornton highlights a shocking fact. More than half of the stents placed after a questionable stress test provide no real benefit to the patient's survival or quality of life. What they do provide is the risk of bleeding, kidney damage from the contrast dye, and long hospital recoveries. It happened to Robert, a 76-year-old amateur gardener. He mentioned he got more tired climbing a hill. He was scheduled for a stress test as a precaution. The result was unclear, and he ended up with a catheterization and a stent. That same night, he had an allergic reaction to the contrast dye that affected his kidneys. He spent a week in the hospital, and his fatigue never changed, because it was never a cardiac issue, but simply the natural process of aging. If you don't have classic cardiac symptoms like crushing chest pain with exertion, a stress test can be a ticket to an unnecessary complication. Safer alternatives, like a resting electrocardiogram, are often a much wiser starting point. And now, the checkup you probably didn't expect to see here. Checkup number 2, the routine colonoscopy. Yes, you heard that right, the colonoscopy. The gold standard procedure for colon cancer screening is not always the best choice after 70, and medical guidelines rarely recommend it after 75 unless specific symptoms are present. Why? Because the balance of risk and benefit changes dramatically with age. The bowel prep with powerful laxatives can cause severe dehydration and kidney damage in an older person. The sedation required for the procedure carries greater risks for cognitive function, and the procedure itself has a small but real risk of perforating the bowel. a life-threatening complication. Dr. Alex Thornton summarizes it bluntly. Medical guidelines, like those from the U.S. Preventive Services Task Force, suggest stopping routine screening at age 75 because, at that age, for every one life saved, several people suffer serious complications from the test. Furthermore, many of the polyps found are so slow-growing that the person is more likely to die of another cause before that polyp ever becomes a problem. Think of Martha's story, a 74-year-old grandmother. With no history and no symptoms, her doctor insisted on a colonoscopy. During the procedure, a tiny polyp was removed. That night, she suffered a bowel perforation. She spent 9 days in the hospital, and her energy never fully returned. A review of her chart revealed she already had 2 previous colonoscopies with perfect results. There was no solid medical reason to repeat the test. For older individuals, there are much safer alternatives, like non-invasive stool tests that can be done in the comfort of home. They detect the vast majority of concerning cases without the risks of PrEP and sedation. And with that, we arrive at checkup number 1. The most overused, the one marketed as the pinnacle of prevention, and the one that might just be the most dangerous of all. Checkup number 1, the full-body CT scan. Marketed in executive health packages, these scans are advertised as the ultimate tool to find cancer before it appears. But the truth revealed by scientific evidence and emphasized by experts like Dr. Alex Thornton is shocking. First, these scans bathe your body in a massive dose of ionizing radiation, equivalent to hundreds of chest X-rays. Recent studies suggest that the rise in the use of these CT scans could be responsible for a percentage of future cancers, similar to other well-known risk factors. It's the ultimate paradox, a test to detect cancer that could actually be helping to cause it. Second, the scan is almost guaranteed to find something: nodules, cysts, or calcifications that are, for the most part, benign findings and a part of the aging process. But the moment they appear on a radiologist's screen, all alarms go off. This triggers an avalanche of more tests, needle biopsies, and immense panic, all for something that was better left unfound. The American College of Radiology is unequivocal. Full-body CT scans should never be used as a general screening tool in people without symptoms. The potential for harm far outweighs any unproven benefit. If there are clear symptoms, like unexplained weight loss or persistent pain, a targeted CT scan of a specific area makes perfect sense. But scanning the entire body, just in case, is like using dynamite to find a needle in a haystack. You might find something, but the collateral damage from the process could be devastating. So there you have it. 5 checkups that, while well-intentioned, can be a path to overdiagnosis and overtreatment. Modern medicine is an incredible tool, but sometimes the wisest choice is the most conservative one. Before agreeing to any test, always ask, what will we do if this test finds something? And what are the real risks of this procedure for someone my age? If the answers aren't clear, it might be time to press pause. As the philosophy of experts like Dr. Alex Thornton reminds us, true prevention doesn't start in a scanning machine, but in our daily lives. Staying active, eating real food, sleeping well, and above all, choosing our checkups wisely. Now, we want to hear from you. Have you had a similar experience? Or do you know someone who suffered complications from a test that turned out to be unnecessary? Share your story in the comments. Your voice can help others make more informed decisions. Thank you for joining us on this investigation.